Velocity vector imaging helps in detecting right atrium dysfunction in early-stage obstructive sleep apnea syndrome. Obstructive sleep apnea syndrome may lead to series of cardiovascular disorders like right ventricular dysfunction and coronary artery disease. Some previous studies had shown that right atrium enlargement is an independent predictor of prognosis and mortality in pulmonary hypertension patients. The study was performed to evaluate the changes of right atrium function in patients with obstructive sleep apnea syndrome using velocity vector imaging and to assess the application of velocity vector imaging technology. Individuals with obstructive sleep apnea syndrome were included in the study. Individuals with cardiac valve disease, coronary artery disease, obstructive or restrictive lung disease, diabetes mellitus, atrial fibrillation, left ventricular systolic failure, hypertension, were excluded from the study. The study included 101 subjects, in which 71 subjects had obstructive sleep apnea syndrome, and 30 subjects were healthy individuals. Patients with obstructive sleep apnea syndrome were further divided into 3 groups, based on the apnea-hypopnea index. Namely, mild obstructive sleep apnea syndrome group, moderate obstructive sleep apnea syndrome group, and severe obstructive sleep apnea syndrome group. The linear dimension and volume parameters including right atrium transverse diameter, right atrium maximum volume, right atrium longitudinal diameter, right atrium minimum volume, right atrial volume before contraction, were calculated with the help of digital images of apex 4-chamber views. The total right atrial passive emptying fraction, right emptying fraction, right atrial active contraction emptying fraction, were calculated. The velocity vector imaging data was used to measure the right atrial strain rate in ventricular systolic phase, right atrial global strain, right atrial strain rate in ventricular late diastolic phase, and right atrial strain rate in ventricular early diastolic phase. The right atrium global longitudinal strain was lower in severe and moderate obstructive sleep apnea group when compared to the control group. The systolic longitudinal strain rate of right atrium was lower in severe obstructive sleep apnea syndrome group as compared to the control group. The study results concluded that the right atrium function was impaired in obstructive sleep apnea syndrome patients. It was found that the right atrial global strain and early diastolic longitudinal strain rate of right atrium decreased earliest, suggesting that the strain rate and strain were the earliest parameters that reflected myocardial function damage. Velocity vector imaging method may help in early detection of myocardial dysfunction of the right atrium in patients with obstructive sleep apnea syndrome.